Autoregulation is the ability of an organ to maintain a constant blood flow despite changes in perfusion pressure. This occurs in the absence of neural or hormonal influences because it's the organ's intrinsic ability to get the job done and maintain that constant flow. This means that local mechanisms or metabolites will usually mediate the autoregulation. One exception is the skin. The skin has very little autoregulatory capacity and is therefore mostly under control of the sympathetic nervous system. Alpha-1 mediated vasoconstriction in the sympathetic nervous system is what regulates blood flow to the skin. The heart itself uses products of cell respiration, specifically carbon dioxide and adenosine, to modulate the coronary artery vascular tone. So for example, in a heart that is beating much faster and harder, the myocytes mitochondria will be working hard, they'll be making more ATP, they'll be producing more carbon dioxide via the Krebs cycle. This will result in coronary artery vasodilation to increase the blood flow to the working heart. In addition, ATP will be consumed, resulting in increased adenosine presence, also leading to coronary artery vasodilation. This is an example of autoregulation in which local metabolic factors result in increased perfusion or the autoregulation of blood flow to the organ to keep it perfused so it can function appropriately. Nitric oxide is another local metabolite that provides key vasodilatory properties to local areas. Any question about nitric oxide regarding autoregulation will definitely ask you about the biochemistry and the basic signal transduction cascade associated with nitric oxide. So let's review that here. Nitric oxide is created by the oxidation of arginine, an amino acid. It is done so by nitric oxide synthase, which is present in the endothelium. We know that nitric oxide diffuses over to the adjacent smooth muscle cell in the blood vessel. When it's in the smooth muscle cell, nitric oxide induces soluble guanylyl cyclase, SGC, to produce cyclic GMP from GTP. Cyclic GMP causes smooth muscle cell relaxation, and in the end this makes your vessels dilate. You have to know this mechanism because there are several drugs that work by preventing cGMP breakdown, meaning we keep cyclic GMP levels high to increase relaxation and vasodilation. Do you know what important medication that's used to treat erectile dysfunction that acts through this way? That would be Viagra or sildenafil. So it's relatively important to know this pathway because it brings together physiology with biochemistry and pharmacology. This is a very high yield topic that you may see on your Step 1 exam. The tie-in with pharmacology includes the afil medications, such as sildenafil, or more commonly known as Viagra, which is a phosphodiesterase 5 inhibitor. Remember, phosphodiesterase is the enzyme that breaks down cyclic GMP into its inactive form. As we discussed, cyclic GMP results in relaxation of vessels, so if you inhibited phosphodiesterase 5, you would see an increase in your cyclic GMP levels, and as such, greater relaxation of blood vessels. So sildenafil, or Viagra, and the other erectile dysfunction medications work by blocking phosphodiesterase 5 and relatively increasing our cyclic GMP levels. Here is an actual image of the shaft of the penis, which is an important feature with Viagra usage. We can see that the smooth muscles in the corpus cavernosa are the ones that relax. The smooth muscles relax and cause increased blood flow into the penis that causes an erection. Here is a cross-sectional image of the glomerulus. We're going to view this image and discuss the mechanisms that are highly testable in terms of autoregulation that occurs within the kidney. There are two testable mechanisms of autoregulation that the kidneys use: the myogenic response as well as tubuloglomerular feedback response. The myogenic response refers to stretch-sensitive cells that exist within the afferent arteriole. These cells respond to excessive stretch in the afferent arteriole and cause vascular constriction or smooth muscle constriction in order to counteract that stretch as a result of increased blood flow. So when there's increased blood flow to the kidneys, These stretch-sensitive cells sense that, and in response, they'll constrict in order to tamp down the blood flow to the glomerulus in order to ensure optimal glomerular blood flow. Remember that glomerulus needs just the right amount of blood flow in order to filter appropriately. If there's too much blood flow, the afferent arteriole is going to constrict in order to reduce that blood flow. If there's too little blood flow, the afferent arteriole will dilate and allow for increased blood flow to the glomerulus. Tubuloglomerular feedback similarly regulates afferent arterial vascular tone. It does so through the communication of the macula densa, the juxtaglomerular cells, and the afferent arteriolar smooth muscle. The macula densa is a special cellular unit that exists in the distal convoluted tubule. This is a salt sensing unit that essentially measures the concentration of salt or sodium within the distal convoluted tubule. As a result, it will communicate with the afferent arteriole in order to increase or decrease blood flow to the glomerulus based on that salt concentration. If the salt concentration within the distal convoluted tubule is high, the macula densa will communicate with the afferent arteriole in order to say that we need to slow down the amount of glomerular blood flow, so we're going to want to constrict the afferent arteriole. In contrast, if there is low sodium concentration, the macula densa is going to want to communicate to the afferent arteriole and say, hey, we need some more blood flow, I'm not getting enough sodium, and so I want to increase our glomerular blood flow. It does so by communicating with the juxtaglomerular apparatus, which is a group of cells right next to the glomerulus that will synthesize and secrete vasodilatory factors such as prostaglandin E2 and prostacyclin. In response to low sodium sensed by the macula densa, juxtaglomerular cells will synthesize and release prostaglandin E2 and prostacyclin. This mechanism gives us a understanding of why NSAIDs, or non-steroidal anti-inflammatory drugs, can cause kidney damage. NSAIDs will cause prolonged arteriolar vasoconstriction because the drugs inhibit cyclooxygenase, which is the enzyme that's responsible for making these two molecules. So as a result, NSAIDs block COX-2, decreasing the synthesis of prostaglandin, prostacyclin, thus breaking up or inhibiting the afferent arteriolar vasodilation in response to juxtaglomerular release of these molecules. So as a result, in patients with long-term NSAID use, you worry about reduced kidney perfusion and possible ischemic injury, particularly in patients who have underlying renal disease. So I hope this review of certain autoregulatory mechanisms will help you understand that organs have their own intrinsic mechanisms that they can rely on to ensure appropriate perfusion so that it can perform its vital physiologic function appropriately.